In this video, we'll look at the muscles that are part of Part C of the Muscle Lab. So these are muscles that are really in the area of the hips and the legs. So let's start and we'll zoom in. And as we zoom in, we'll highlight some of these muscles. And the first one we're going to look at is the gluteus maximus. And of course, the name, the gluteal region, it's the butt area, and also maximus gives us the sense that size, right? So remember, muscle names tell you something sometimes about location, sometimes about size, sometimes both. So of course, it's bilateral. So there's, of course, the gluteus maximus. And then the next one on the list is the iliopsoas. Some people call it the iliopsis. Now, this is a very interesting muscle. To find it, we have to go into the the groin area, and I'm going to click on here. Actually, I'm going to remove some muscle. So I'm going to remove here the external oblique and the internal oblique. So let's hide those, and let's kind of see if we can get down to get a better view. There we go. Okay, so here we are. Now we're looking for the iliopsoas, and the iliopsoas is actually made of two muscles, and you can see one of them highlighted here. This is the iliacus, and the iliacus, of course, gets its name because it's on the iliac crest, and let's isolate it for a second so you can see how it's really on that iliac crest, and it comes from there. Now what happens is the iliacus is joined by the psoas muscle. And let's have a look at this, and let's isolate this one too. And you can see it comes off from the lateral margin of a number of the vertebrae and comes down. Now what happens is both the iliacus and the psoas join together in the lower region, and you can see the joining right there where they're both coming together and form the iliopsoas. So it's really two muscles, but we'll consider them as one here. Now, we're going to stay in this region because there's a number of muscles to look at. And the next one over is the pectineus. Now, the pectineus really forms the floor of something called the femoral triangle. And the femoral triangle is a region that's bounded by a number of muscles, and we can see a number of them here. This one we're going to see shortly, which is the sartorius. Also, we have the inguinal ligament forms one of the boundaries of it, and also we have the things like the adductor longus, that these all form the boundaries. And if you notice, all three of these form a triangular area, and the floor is the pectineus. Now, one little side note, I'm going to actually add some arteries in here. You can see this is where the femoral artery passes through here. And this is one area the femoral artery is actually fairly exposed to injury, because most of the femoral artery is hidden behind muscles as we go further down. So pectineus forms the floor of the femoral, part of the floor of the femoral triangle, not the whole thing. And you can see that we have the femoral artery on top of it. So that is the pectineus. Now, we're going to head down onto the thigh, and as we head down to the thigh, there's a number of muscles to look at. And down here is what most people know as the quadricep group, stands for four heads. And we're going to have a look at a few of them. Now, the ones we want to identify are the rectus femoris. We can see it located right here, and let's just quickly isolate it. You can see it actually goes above the hip joint, and it ends just above the knee joint. Let me back up here. Okay, so that was the rectus femoris. The other one, now we have two muscles, the vastus lateralis and the vastus medius. Vastus tells us it's big, and of course lateralis and medius tell us its position. So here, not surprisingly, we have the vastus lateralis muscle. And let's quickly have an isolated view. You can see it starts up there near the trochanter, and it comes down, and if we're to follow the tendon, it actually crosses, it merges with tissue and crosses the knee there. So that is the vastus lateralis, and of course, if I was looking for the vastus medius, I'd look on the medial side, and yes, indeed, that's where it is. We have the vastus medius right there, and we can quickly have a look. We can isolate it. And you can see it has sort of a medial position and a similar sort of range of where it starts and where it ends as its counterpart. All right, so let's move on to the next one, and we can look at the Sartorius. Now, this one, the name gives you a clue, but unfortunately you'd have to speak Latin and know some pretty fancy words. So someone who has good sartorial skills is someone who sews, a tailor, someone like that. And often they used to sit with their legs crossed and drape the fabric over their knees as they would hand sew things. And this muscle does help you sort of do that. Sometimes it's described as, oops, I stepped in dog poo muscle. Believe it or not, I've heard that referred to, that you think you stepped in something, or bubble gum, and you sort of look down and you sort of rotate your foot up towards you in a sort of the midline of your body, and it helps with that. So this is the Sartorius, and you can see quite a long muscle, quite a long thin muscle as it travels. All right, so let's go to the next one, and the adductor magnus. Remember adduction, ADD. Adductor means you're going to bring a limb into the midline, and magnus tells us that it's probably a pretty big one. So let's try and highlight it, and there we go. There's the adductor longus. Okay, I just want to show you there's a bunch of adductors here. We have the adductor longus there. We have the pectineus, which you've already seen. Here's another one we're going to see shortly. That's the gracilis. And if we sort of look down here, we can probably, let me remove the gracilis for now. We can start to see there is the adductor magnus right there. So it's quite sort of towards the midline. It's in the medial part of the thigh, and I want to isolate this one to give you a sense. So you can see it is big. You can't see most of it from the outside because it's covered with muscles, but look at the extent. It attaches up here onto the pelvis. Also, it's attaching, if we roll this over, it's attaching onto the medial aspect of the linea aspera, which was one of the bony features you had to know. And if you actually look down here at the bottom, there is a large hole. That is actually a passageway for artery, nerves, and veins. And it's actually through this hole that the femoral artery will travel from the front of the thigh to the back of the thigh. Okay, so that was the adductor magnus. Now, we have a few more to go. The next one is gracilis. Now, gracilis, think of the name gracilis. It means graceful, gracile, sort of light, thin, etc. And we find it tucked back here in the middle area. We just gotta, it's hard to get actually a really good view of it. Let's try from this side. And there we go. That's a better view. So the interesting thing about the gracilis, it certainly is very medial. It's very thin. It's very gracile in its structure, but it is a very long muscle. And if you think about it, look at its positioning. It really does sort of separate the anterior part from the thigh from the posterior part of the thigh in the medial part of the thigh. So there it is. Let's isolate it and we can really see it. So you can see how graceful it is, gracile, and it starts at the pelvis. And this is one of those muscles that actually crosses, technically it does sort of cross the, spans the hip joint, and also you can see it clearly spans the knee joint. The gracilis, very thin. All right. Okay, so that's the gracilis. Now, if we head to the back, we can start to see some of the muscles back here. Often people call these the hamstrings. I think that's a really poor terminology, and certainly some we don't want to use in the world of A&P because we actually have different muscles back here to look at. And when you look back here, if you look carefully, you'll see that there's these three major muscle masses that we have to start thinking about. And the muscles are the biceps femoris, and let's go to the biceps femoris. So this is the biceps femoris, okay? You can see, now how do you tell them apart? Because I got this muscle mass, this one, and this one. Well, the one thing to always remember is the large muscle mass that is the most lateral in the posterior aspect of the thigh is the biceps femoris. And we can quickly isolate this one. You can see they don't show the tendon extended down there, but you can see it. It's a fairly big muscle. Okay, so the biceps femoris is the lateral one. Now, as I head over here, I have two muscles. I have the semitendinosus and the semimembranosus. Now, think of the names. Semitendinosus suggests that it's partly tendinous. And certainly, as we look at the semitendinosus, as I look down, let's highlight it in the yellow-orange again, you can see as I go to the bottom, there's quite a long tendon part to it. That is the semitendinosus. Now, it tends to be, it's in a more superficial position than its neighbor, who is the semimembranosus. Now, I'm going to isolate the semimembranosus and have a look. You can see down here the tendon is actually much wider, almost membrane-like, and that's one way to remember it. And let's go back and see them in position. As we see them in position, you can clearly see the three. So let's just quickly remind ourselves. If I'm lateral, the big muscle that is back here is part of the biceps femoris. That's the lateral of the three. And then I have the two semis. I have the semitendinosus, and it looks like it's more tendinous, and also it's the more superficial, and semimembranosus, which is more membrane-like in the inferior part of the muscle, and it's also deeper. Okay, so there's two more to have a look at. And let's spin it around. And now we're looking at some of the muscles in the front part of the leg. And tibialis anterior is right here. And you can see tibialis anterior. Most people can palpate this if you lift up your foot, your toes towards your knee, sort of flex in that way. Part of the muscle that would be activated, one of the muscles, there's others, would be the tibialis anterior, and you can see its positioning. You can see how it starts up near the knee, and it then crosses over to the medial aspect of the foot, and actually comes in and really connects into the medial aspect of the foot. So that's tibialis anterior. The last one on our list for this muscle group would be the popliteus. Now let's see if we can get a good view of it. I'm going to go here. This is a great feature of some of these programs, is that we can actually do a search. All right, so let's highlight it, and there you can see it. It's really tucked in there, the popliteus. Now let's isolate it. And you can see that it comes around, and think this is the popliteal space, so it makes sense as to its location and its name. And you can see how it wraps around and helps to stabilize the knee. That's one of its functions. Okay, so those are the muscles of section C, which are the muscles of the hip and the leg. Remember, spend some time. You really have to spend time. You have to look at your books, use different resources to try and get a deep understanding.